Hello, my name is Kim Urenko. I am the Joint Replacement Coordinator with WellSpan Orthopedics. I will be taking you through your joint replacement education class. If you don't have it already, I recommend pausing the video and going to grab your binder as well as a piece of paper to take some notes. In this class, we will go through an overview of a joint replacement, getting ready for surgery, what to expect during your hospital stay, planning for discharge, and then recovering at home. This is a diagram of a hip replacement. So to do the hip replacement, your incision could be on the front or the side of your hip. It depends what approach your surgeon is using. And if you're not sure, you can talk to your surgeon about that. There are 4 parts to the hip replacement. So this is the new socket that you will have, and that goes into your pelvis. This portion is the stem that goes down your thigh bone. On the end of that, there is a ball. These pieces come together with a plastic liner in the middle to create a new ball and socket joint. So these pieces will glide on each other smoothly as opposed to the crunching, painful motion that you probably have with your hip right now. This is the diagram of a knee replacement. For our knee replacements, our incision goes down the front of the knee, just right down the middle. The knee replacement is made up of 3 or 4 parts. So the first 3 parts are these parts that you see here. So this top bit is your thigh bone or your femur. There is a metal cap that goes on the end of that bone. This bottom part is your shin bone or your tibia. There's a metal cap that goes on that bone as well. Then there's a plastic spacer between those 2 pieces of metal, and they then glide smoothly over each other, restoring your knee motion. Some people will have a 4th piece, which is a plastic button that goes on the back of your kneecap. So your kneecap will still be there. It's your same kneecap that you keep, but you may have a plastic piece that goes on the back of it. And if you're interested, if you have that or not, that's something that you can ask your surgeon about. So in getting ready for surgery, we want to think about what's going to happen after surgery. So after surgery, we want everyone to have a coach. So a coach is a support person or group of people who are going to help you get ready for surgery and then help you afterwards as well. So different things that they may need to help you with before or after surgery: bathing and dressing, your transportation, doing your exercises, keeping track of medications, and just making sure that you're safe. So how is your coach going to know how to do all this stuff? So first, you have this class as well as the prehab class. You should have the links to those videos. It's a great idea for your coach to watch both of those videos. So if they don't have those links, go ahead and just forward that email to them. They should attend at least 1 therapy session while you are in the hospital. And if you are leaving the same day of surgery, we want them to be there for all of it. So we want them to be there for all of your therapies that day. We also would like your coach to be there as the nurse is going through your discharge instructions. There's a lot of really important information that they're going to go through with you, and you as the patient, you're just not going to remember all of it. So to have your coach there is really important. And then after you're discharged from the hospital, it's a good idea for your coach to come and see some of your therapy sessions. So as you go through your therapy, they're going to start doing new things with you, more things with you. So it's a good idea for your coach to see some of that and see what the expectations are. An important part of planning for surgery is to make sure that we have our plan for you for after surgery. So our plan A for everyone is that you will start outpatient therapy a few days after surgery. So your surgical scheduler should have already set up that appointment for you. When you go for that first initial outpatient therapy appointment, they do an evaluation and they then make the plan for how often you're going to come into the office. So we just get you set up for that first appointment, and then they will get you set up for your future appointments after you're seen initially. Now, I do get a lot of people asking about home health. I know somebody who had home health. I had home health before. We do prefer for you to start outpatient initially because you just get much better quality of therapy by going to the location, getting to go to the gym at the location, use the equipment that they have. You just recover quicker and better by going to outpatient therapy. So in that week before surgery, some different things that you can be doing. Make sure that you're getting everything packed. So there is a packing list in your binder in section 6. So section 6 is your section that talks about getting ready for surgery. I think the most common question I get is just what kind of clothing should people wear? So you do want pants that are going to be loose fitting. So after surgery, our hip replacement patients, your hip is going to be swollen. Our knee replacement patients, your knee is going to be swollen. So you want pants that are loose, that are going to be easy to get on and off. And you want supportive shoes that are going to be closed toe and closed heel. So sneakers are a good idea, something sturdy that's going to stay on your foot. You want to make sure that you have your rides together, you have your coaches know where they need to be when they need to be there. Meal planning is important, especially if you are the person in your home who usually makes your meals. You are not going to be cooking that week after surgery. So are friends and family going to bring you meals? Do you need to get meals together? Freezer meals, crock pot meals are a great idea. Make a pot of soup that you could eat for the week. A lot of people after surgery often don't have much of an appetite as well. So if you think that might happen to you, it's also a good idea to pick up like a protein shake, like Boost, Ensure, something like that, to make sure that you're getting good protein after surgery. In that week or two before surgery, you will get a call from one of our pre-hospital assessment nurses, and they will go through all of your medications with you. So there are certain medications that you need to stop, sometimes a week before surgery, sometimes a few days before surgery. So that you'll get a call from one of our nurses, and they will go through all of your medications with you in detail. The week before surgery, it's very important to let your surgeon know if you have any changes in your health. So, signs and symptoms of an infection. If you have an infection around the time of surgery, your surgery will likely need to be delayed. So, infection could be temperature over 100.5. If you have any signs of a urinary tract infection, such as frequency, burning, or odor when you pee, or if you are on antibiotics for any infection anywhere on your body. It's very important to let your surgeon know. If you have an infection somewhere else in your body, it puts you at much higher risk for an infection in this brand new joint that we're putting in. With that in mind, your skin is very important. Very, very important. I'm going to circle here. Call your surgeon's office if you have skin concerns anywhere on your body. So, anywhere on your body could be skin tears, animal scratches, rashes, poison ivy, cellulitis. What we see frequently is rashes in people's groin or under any skin folds. Any of these areas on your skin, puts you at high risk for infection, because it's somewhere that bacteria can go right into your bloodstream, and bacteria loves metal. Well, your surgeon is putting a huge piece of metal in your body. If the bacteria gets on that metal, it causes a huge problem. So any skin concerns anywhere on your body, your surgeon needs to know. So from this moment until your surgery, I want you to be really careful with your skin. Really careful with your skin. Unfortunately, it is the most common reason that we see surgeries canceled is skin issues. So please call the office as soon as it happens so we can treat whatever the issue is. Do not wait until the day of surgery, because if you come in on the day of surgery, you have a big scratch on your arm, you have a rash on your groin, surgery will likely be delayed. With all that being said about your skin, 3 days before surgery, no shaving anywhere on your body. It is more important to protect your skin than it is to worry about stubble, hair. We're not concerned about it. So no shaving anywhere on your body 3 days before surgery. And then also just be mindful to protect your skin, please. Again, for your skin, we are going to have you do special showers before surgery. So if you have not already received it, when you go in for your pre-op appointment, you will get a bottle of soap from the office to use for your shower before surgery. Now, some of you may have a kit that has sponges, and some of you may just have a bottle of soap. And we'll go through what to do with that here. So you are going to take 2 showers, the first being the night before surgery. That first shower, we say you can do it anytime after 6 p.m. You can wash your hair with your normal shampoo and rinse it out. Wash your face with your regular soap that you use. And then from your neck down, you want to wash with half of the bottle of soap. If you have the kit with the sponges, use one of the sponges. If you just have the bottle of soap, use a clean washcloth. And you are going to wash that from the neck down, avoiding the genital area. So everywhere from the neck down except for the genitals. Just wash like you normally would, and then let the water rinse the soap off. This kind of soap, if you've done showers like this before, it used to be that you had to leave this soap on your skin for 5 minutes before you rinsed it off. That is no longer recommended. So you can just wash like normal, let the water rinse it off. When you get out of the shower, I want you to dry off with a clean towel, and you want to put on clean clothes, and you want clean sheets and pillowcases on your bed. The reason for that, we are trying to get rid of the bacteria that lives on your body. If you do this shower and then go to bed in the same sheets and same pillowcases as you've been using all week, you're just putting all that bacteria right back on your body. So everything needs to be clean after your first shower. And once you take that first shower, you may not put on lotions, powders, creams, hair products, makeup, or deodorant. So that soap is the last thing that goes on your skin. You have 2 more things to do the day before surgery. So we want you to drink Gatorade the night before surgery and the morning of surgery. This may seem a little different to you. It might be something you've never heard of before. This is part of our anesthesia protocol to help you to feel better when you wake up from surgery. So we found that being well hydrated makes you feel better after surgery. So the night before, I want you to drink 28 ounces of Gatorade. And this is you can start this anytime after 6 p.m. You can use any flavor that you like as long as it is a clear flavor. So not one of the like cloudy, they have like a cloudy white color, not that flavor, and not red. Any other color is fine, just not the cloudy colors and not the red colors. If you are diabetic, please choose the low sugar variety. There's one marketed as G2. We do want you to have a low sugar variety and not a sugar-free variety because the carbohydrates is part of what helps you to do better after the surgery. So you can drink this throughout the evening, so anytime between 6 p.m. and midnight to finish that 28 ounces of Gatorade. Now, some people ask me, they say, well, I don't like Gatorade. What do I do? So a few tips that I've picked up from people. So people have told me it helps if it's very cold. People have told me that drinking it out of a straw helps you to get it down easier. And I had one patient tell me that she put it in a wine glass and it made her feel like she had something a little special. So those are just some tips I've picked up from patients along the way. Along with the Gatorade, we also want you to take Tylenol before you go to bed that night. So we want you to take 2 500 milligram tablets of Tylenol. That is extra strength Tylenol. And you'll take those before bed, the night before surgery. The day of surgery, you have a similar to-do list. So the day of surgery, you are going to take another shower with that special soap. So it is the same procedure. You'll wash your hair if you would like to. You don't have to wash your hair again. And you can wash your face again if you would like to. What you do need to do is from the neck down with the rest of that special soap. So if you have the kit, use another sponge out of the kit. If you don't have a kit, I want you to use another clean washcloth. So not the same washcloth you used last night. It's going to be a new clean washcloth. And wash again from the neck down, avoiding the genital area. Rinse it off. When you get out to dry, I want you to use another clean towel. So not the same towel you used last night. So sorry, we're making a lot of laundry for you coaches. When you come back, you'll have a lot of laundry to do. But it's really important that we make sure that you use clean washcloths and clean towels so you're not putting bacteria back onto your skin. We want you to put on fresh clothes for that day. And again, no lotions, powders, creams, hair products, makeup, or deodorant. We also want you to drink another bottle of Gatorade the day of surgery. So it's 2 bottles of Gatorade total, one the evening before surgery and a second the day of surgery. Now this clock starts after midnight. So you can, if you wake up in the middle of the night and have to use the restroom, you can start drinking your Gatorade. You have up until 2 hours before your arrival time to the hospital to finish this second bottle of Gatorade. So that timing is going to be different for everyone depending upon what time of day your surgery is. So those of you who have the first surgery of the day, that window is going to be short, and I just say drink as much of it as you can. If your surgery is later in the day, it's great because you'll actually be able to get up and drink something rather than having to starve yourself and not drink anything all day long. So it's another 28-ounce bottle of Gatorade. You can start that anytime after midnight and needs to be finished 2 hours before your arrival time to the hospital. On the day of surgery, it's really important that you listen to your pre-hospital assessment nurse's direction as far as what medicines to take that day. So that morning, please take those medicines that they told you to take. You can take them with your Gatorade while you're drinking all that Gatorade. Take those medications. The only medications you need to bring to the hospital is if you use an inhaler, eye drops, or topical medicines. So these would be like multi-dose medications. We do ask that you bring those with you. Pills, we will take care of. We have what you need at the hospital. If you have sleep apnea and use a CPAP, please bring your mask and your tubing. A machine will be provided and our respiratory therapist will get that set up for you. If you have any questions about your medicines, please call the pre-hospital assessment nurses back and they can go through your questions with you. And make sure when you come to the hospital, bring your binder with you, bring your walker, your ID, and your insurance cards. As far as your hospital stay, our goal for everyone is to get you home as soon as it is safe for you to be at home. So for many of you, that may be the very same day of surgery. Your surgeon will talk to you about if they think you are a candidate for same-day discharge. I will also talk to you about it, so we make sure that you do know that that is the plan. If not same-day discharge, we would expect for you to be in the hospital overnight. So you can either plan to leave the day of surgery or the next day. For everyone, we make sure that you are in the hospital with us until, first of all, you're medically stable. So you're able to eat and drink, you're peeing on your own, your pain is controlled, your vital signs are stable, and then you are safe at home. So you can do the things that you need to do, walk around, get up and get down, with the help of your coach. When you get to the hospital, they will take you back to the pre-op area. In pre-op, you will see your surgeon and your anesthesiologist, and you have any last-minute opportunities to ask questions. They will do another skin prep, so they will use special wipes to clean your skin again because it is so very important to have clean skin. They will also do swabs in your nose to help kill any bacteria that's living in your nose. These are iodine-based swabs, so if you have an iodine allergy, we need to know about it so that we don't swab your nose with iodine. So please, if you have an iodine allergy, make sure that we know. For the knee replacement patients, you will receive a nerve block in the pre-op area. So you'll actually get 2 injections and they work kind of like Novocaine at the dentist. So you'll get 1 injection in your thigh and you'll get another injection behind your knee. And these are numbing medications that are going to help with your pain control for after surgery. For the hip replacement patients, there are no nerve blocks that are given, but fortunately for you, the hip replacements are not usually as painful as knee replacements. So our knee replacement patients need a little extra support with their pain management. When you get signed in the pre-op area, they can sign your support person up to receive text messages with updates on your progress. So for the coaches sitting out in the waiting room, you can get text messages from the nurse in the operating room and the nurse in the recovery room to let you know where we are with surgery, how things are going. In the operating room, the type of anesthesia that we use is spinal anesthesia. The anesthesiologist will talk to you about this in the pre-op area, but for most of you, it will be spinal anesthesia. They inject a numbing medicine in your back, and it makes you numb from the waist down. We prefer this method of anesthesia because you are still able to breathe on your own and you wake up feeling a lot better. One of the questions I get frequently is, will I still be asleep? So yes, you will still be asleep during the surgery. You're not going to hear what's going on. You're not going to be talking to your surgeon, but it's not the general anesthesia where you are so deep asleep that they put a tube down your throat. So it is spinal anesthesia is what most of you will receive. When you wake up in the recovery room, because of that spinal anesthesia, you may still be numb from the waist down. So that could mean that your feet are a little bit numb. It could mean you're still entirely numb and not able to move your legs at all. The spinal wears off a little bit differently for everybody. With that numbness, oftentimes you cannot feel your bladder, and your bladder may be full, but you don't know it. So we have a little ultrasound machine that we use to look at your bladder. If your bladder is full and you can't feel it, we will do a catheter to drain your bladder. That's a catheter that just goes in and comes right back out. We do not put them in that stay in. So we will keep an eye on your bladder. You will transition to the next phase of care when the spinal starts to wear off. So those of you that are staying overnight, you will transition to your room where you're staying. Those of you that are leaving the day of surgery, you will move into the next phase of our observation unit. So it is usually about an hour before you're ready to transition to that next phase, but it could be shorter or longer depending upon your numbness or your other symptoms that they're managing for you in the PACU. After you transition from the recovery room to that next phase of care, our goal for everybody is to get you out of bed on the day of surgery. So physical therapy will see all patients. That's patients who are leaving the day of and patients who are staying overnight. And occupational therapy will see the same day discharge patients. For those of you that stay overnight, occupational therapy will see you the next day. So therapy for our patients who are leaving the same day, they will make sure that you're able to do everything to be able to go home safely. Then we will also continue to bladder scan until we know that you're able to empty your bladder on your own. That spinal anesthesia sometimes hangs on to your bladder for a little while, and it can take a while until you're emptying your bladder normally. Now, staff will remain with you when you go to the bathroom for your safety. And we do not want you to attempt to get out of bed or stand from a chair or a toilet on your own. You always need to have a staff member present with you anytime you're getting up and moving. Pain management is a very important part of your recovery. Now, you are sitting here listening to this presentation because you have pain. You know pain. You know it's part of your daily life. So unfortunately, there will be pain after surgery. For some of you, that pain may be worse than the pain that you're having now as you are recovering. For some of you, the pain will be different than what you're having now, but it will still be there. So our goal is to achieve a pain level that's acceptable or tolerable. And what that means is you still have pain. We can't get you to no pain, but the amount of pain that you have is you're able to eat, drink, sleep a few hours at a time, so you're not sleeping the night through. You're able to walk and you're able to do some therapy. Now, this pain is temporary pain. So as you're going throughout your recovery, that pain is going to get better, that pain is going to get less, but those first few weeks can be rough. So as when we're talking about pain, you all have heard this so many times before, but we will ask you to give us a number between 0 and 10. 0 is no pain whatsoever, and 10 is the worst pain you can ever imagine. One of our surgeons describes a number 10 as somebody just set you on fire, and that's a number 10. So you tell us what is the acceptable pain number for you. Maybe you are used to living with a lot of pain and you can deal with pain at an 8, and that's tolerable for you. Maybe I am not used to pain and I want my pain to be a 2, and that's what's tolerable for me. So we work together to get you to that tolerable level of pain. There are different ways that people describe their pain after surgery. Most people do tell me that it is different than the pain they had before surgery. That is especially with our hip replacement patients. Oftentimes, you guys have that pain in your groin before surgery. Most patients tell me that that groin pain is gone, but now they have incisional pain or muscle pain. The knee replacements is the same way. You still have pain, but it's a different pain than you had before. The way some people describe it, it may be throbbing, it may be aching, you may have a dull pain, it may be sharp, it may feel like pulling, you may have muscle spasms. How long the pain lasts, we say about 2 to 6 weeks is the worst of it, but you'll have good days and bad days, just like you do now. So maybe a day that you're feeling really good, you do a lot of activity, and then the next day is not so good, just like happens now. Or on a day that you had a really big workout with therapy, you may have more pain the next day, and that's just part of the recovery process. Where you may have pain, it may be your knee, it may be your thigh, your hip, your back. Oftentimes people do get pain in other joints than the one that was replaced, just because you're walking differently, you're moving differently. Say you had a right knee replacement, you may have some pain in your left knee if your left knee is bad and you're having to rely on it now. So you may have pain in other parts of your body as well. So what are we going to do to control your pain? You will all be on some type of medication. We give you multiple types of medication that help control your pain in different ways. So you may be on an anti-inflammatory, you may be on a nerve type pain pill, and you may have a narcotic pain pill as well, plus Tylenol. What your medication plan will be based upon your current medical history, what medications you currently take. So that plan, you can talk to your surgeon about what your medications will be after surgery. We don't just throw medications at you, other things are important as well. Deep breathing and relaxation is so important. So many people, when you have pain, you hold your breath and you tense up. So we will remind you, especially when we're getting you out of bed, make sure that you breathe. Breathing is important. Repositioning and movement is very important as well, and I know you all do this already. You sit for a long time, that hip stiffens up, and you need to get up and walk it out. It's going to be very similar after surgery. If you sit for too long, you're going to get stiff, and you need to move and walk out that stiffness. Ice is going to be a very important part of your pain management after surgery as well. You will receive a black ice pack from the hospital. So it's a black sheath that gel packs slide into. You will go home with 4 gel packs, 2 that you can have in the ice pack and 2 that you can have in the freezer. This ice can stay on as long as it is cold. So whenever you are resting, we want ice on that knee or ice on that hip. It's going to help with swelling, it's going to help with pain, and it's going to help to reduce your scar tissue formation. One of the risks with a joint replacement surgery is that you could develop a blood clot. So there are 2 different types of blood clots. A DVT is a deep vein thrombosis. That is a blood clot that would form in your leg. A PE is a pulmonary embolism. That is a blood clot that started in your leg and moves to your lungs, and that is life-threatening. So we do a lot of things to prevent blood clots. One of the things that you can start doing as soon as your legs are able to move is to do your ankle pumps. So prehab, if you've had your prehab already, that's one of the exercises that they showed you. It's just moving your foot up and down. Ankle pumps helps to move the blood throughout your leg and helps to prevent a blood clot. You will all have compression stockings. These help to reduce swelling. which can help to prevent a blood clot. They may be knee high or they may be thigh high, dependent upon your surgeon's preference. If you are staying in the hospital overnight, you will have SCDs. These are sequential compression devices, and these will be sleeves that go around your calf and they pump up and release to help the blood to pool, so it does not pool in your leg, help the blood circulate. Walking is really the best way to prevent a blood clot. So that is why we have, for everyone, we get you up and we get you moving the day of surgery. When you are at home, it's very important that you are walking about every 2 hours. So just getting up, taking a short walk, that is going to help prevent a blood clot. You all will also be on some type of blood thinner medication, and that will be different for each of you depending upon what your risk is. So for most of you, if you are already on some type of blood thinner medication, we will get you back on to that medication. So like if you take Eliquis or Xarelto every day, we will get you back on that medication. For people that may not have much risk for a blood clot, you may be on aspirin, or you may be on a medication called Lovenox. That is a shot that you give yourself every day. So you can talk to your surgeon about what the plan will be for your blood clot prevention medication. When you get home, your recovery really is day by day. So you'll have your pain medications, you'll be taking your blood thinners, you'll be doing those short, frequent walks. The exercises are going to be your most important homework when you get home from the hospital. So the therapists in the hospital will go through what exercises you're supposed to be doing, and you need to continue those until you go for your outpatient therapy. And then outpatient therapy will direct you for your exercises. You're going to be checking for signs and symptoms of an infection, and please do notify the doctor's office immediately if you have any concerns. We already touched on this a little bit, but it's good days and bad days with gradual improvement. Moving forward, after your surgery, please do not go to the dentist for any routine visits until 6 months after your surgery. The reasoning for that, you still have a lot of blood flow going to your joint to help heal that surgery, and you are at higher risk for infection in that 6 months after surgery. The dentist is someone who introduces bacteria into your bloodstream. If you are at a dental visit and they're poking and prodding, that is a really easy way for bacteria to get into your body and then go to your hip or your knee. So we don't want you to see the dentist routinely until 6 months after surgery. If you are sitting here and you know you already have an appointment scheduled within that time frame, please call your dentist to reschedule that appointment. If an urgent dental need comes up, if you break a tooth, if you have a dental infection, we do want you to get that taken care of. But please call the surgeon's office to get an antibiotic recommended before you go to that dental appointment. Now, for the rest of your life, your surgeon may want you to take an antibiotic for any dental visit. Each of our surgeons has a little bit of a different philosophy on antibiotics prior to the dentist, so please make sure that you know your surgeon's plan, so that if you need an antibiotic prior to the dentist, we can get that prescribed for you. And this is me. So again, I'm Kim. I am the total joint coordinator. So I'm just a resource for you as you're going through surgery and after surgery as well. If we haven't spoken on the phone yet, I will be calling you. I'll call you before surgery. I'll call you to check on you after surgery. And I'm just here for you if you have questions. I work with the teams at the office and at the hospital, so I can help answer questions anywhere along the line here. And please, even if you're sitting at home and you're not sure, do I need to talk to somebody about this? Is this a question I need to ask? Just call me and we'll figure it out. So my phone number is in your binder. It's also on the bottom of this page here. So please do feel free to reach out to me if there's anything that you'd like to talk about. Thank you for taking the time to sit and watch this class. I hope you've got some good information from it, and I'm here for you if you have any other questions. Have a good rest of the day.